joining us today for our session. Will be recorded and posted on our YouTube channel. So just a reminder, we are halfway in Defend, and so you've been sent a link to complete the survey, and Emma will post the link in the chat again. So we're just checking in, seeing how things are going, and also it's important for Emma's master's thesis, right, Emma? So thank you very much. We're learning a lot about Defend and behavior change as we go. Also, just a reminder, our personalized coaching sessions are still going, and they're a great resource if you have any, personal questions, especially about diet, behavior change, or some exercises, especially as the weather warms up and we all get outside and maybe doing some fun summer activities. So our behavior change, Danielle is on Mondays, Jamie for nutrition is on Tuesdays, and Bryce for exercise is on Thursdays. Our week 10 challenge for last week was the grocery store challenge. Did any try anything new? You can put it in the chat. I know one of our participants tried yuca, and so that was one of their new things that they tried from shopping the perimeter. And our challenge this week is going to be to assess the walkability of the areas around you. So kind of going with today's theme and thinking about kind of the environment that we live in and what we have access to. Just think about where you can walk, where is it safe, maybe where it's not safe. What are some challenges that you may have, lack of sidewalks, etc. So that's week 11's challenge. We have some new demos for this week on our YouTube channel, new fast facts on our website, some healthy recipes when you're on the run, and some physical activity modifications for chronic diseases. And so I see some good comments in the chat, trying some radishes, eating more vegetables, less processed food. So great job, everyone, on that. So that is enough of me talking. I'm going to introduce today's speaker. So Dr. Di Fang, she is an assistant professor of agricultural economics at the U of A since 2015. She has a background as a research economist with the National Bureau of Economic Research. So they do lots of cool, exciting research around obesity and thinking about the environment and policies. She got her BS in economics actually from Nankai. Is that how you say that, Dee?
Yes.
Okay, University in China, and her PhD in business administration or agribusiness from Arizona State. And so particularly her research is on the intersection between food and health, which is why we're so excited to have her here with Defend. And she's done research in topics like childhood obesity, nutrition programs, food environment, consumer choices. She's very well published, serves on lots of review panels, and is going to share with us a little bit about availability and accessibility and some of the research that she has done. So with that, I will turn it over to you, Dee.
Thank you, Erin and Emma, for inviting me. I'm excited to be here. So I will share my screen. Can you all see my screen?
Yep.
Awesome.
Yep, it's good.
Awesome. So when I was invited to talk about availability and accessibility, I think about this concept in the line of work I do. And the most appropriate topic would be to talk about the food environment. I'm sure in this series, you've already learned so much about physical environment, built environment. So let me just introduce the food environment, maybe in a few more details. So a lot of you might already know what is a food desert, or you've heard about a food desert. So specifically, a food desert indicate neighborhoods or districts with inadequate access to healthy food retail options. So when you think about food desert, you think about access. But the concept is actually twofold. It's not just access, it's also indicate low income. So the USDA, ERS researchers, would point out that a census tract would qualify as a food desert if they meet both the low income requirement and the low access requirement. In particular, a low income is a census tract that has a poverty rate of 20% or greater, or a median family income at or low or below 80% of the statewide or metropolitan area median family income. And the low access is defined as at least 500 people and or at least 33% of the population lives more than 1 mile from a supermarket or large grocery store in an urban area, or 10 miles in the case of a rural census tract. So the 1 and 10 definition is a more commonly used popular definition of a food desert. And you might notice in the definition, we're measuring the distance to a supermarket or grocery store, and how our supermarkets and large grocery stores defined. And these are the food stores that have at least $2 million in annual sales and continuing at other major food departments. So why are we using these large food outlets as a measurement of food environment or food desert? And that's because these food stores generally have access all source or sources of healthy food, and they can afford them at an affordable price. Okay. So in terms of access to food, the percentage that have limited access to a supermarket or large grocery store, it's actually a small percentage. So based on a study done by ERS economist, about 23.5 million people, or 8%, based on the 2000 census tract, live in a food desert. And low-income households often leave food desert to shop where prices are lower. So that basically saying, living in a food desert is not as restricting, because people would move around and shop for the most affordable food. And also when people have access to vehicles, and the location is even less limiting. So about 2.3 million or 2% households in the US live in food deserts do not have a vehicle. So this is a population, the 2% is a population that's most restricted, because they live in a food desert and they don't have a car to get around. So a lot of study has been done on food access research based on food desert. One of many is the USDA Food Access Research Atlas, and it presents a spatial overview of food access indicators for low income and other census tract using different measures of supermarket accessibility. It provides food access data for populations within census tract and offers census tract level data on food access that can be downloaded for community planning or research purpose. So for many of you who are interested in looking different aspects of food desert, or maybe download the data for demo, and this is a website I will direct you to. And let me just briefly share the website so you can see the different options. Okay. All right, so on this website, you can see the legend on the top right corner. So the 1 and 10 is the most commonly used definition of desert, food desert. And that's again 1 mile in the urban tract or 10 mile in the rural tract. But people also use different definitions to look at food accessibility. So vehicle access is another example we talk about. And as you can see, if you look at food access via vehicle access, whether or not having a car, then you can look at the difference in food desert distribution across the US. And you can also zoom into a specific states, such as, well, I got Mississippi, so let's look at Mississippi and the specific county in terms of the different measurement. Okay, so let's go back to my slides. Okay, so I've introduced the large retailers. And what about the small retailers? Well, not every neighborhood can have sufficient demand to support a supermarket. So if you kind of look at the expansion of Walmart, it's not, parallel across the nation in multiple places. It kind of expand through a center. So for small retailers, there's often not enough demand, and they have a higher fixed cost. And for small retailers, stores are defined as stores with less than $2 million in annual sales. For example, dollar stores and less traditional formats are small retailers, such as warehouse clubs to fruits and vegetable stands on street corners. Regardless, small retailers could play an important role in food accessibility. For example, this book by Park Wilde from Tufts University, he's looked at smaller stores and concluded that formats other than supermarket can be especially important for people without access to cars. And small retailers may not have access to fresh food suppliers, refrigeration equipment, or marketing resources to publicize healthier options. Therefore, programs that provide grants, loans, marketing support, or other assistance may improve the availability of healthy food selection in small stores, especially underserved communities. And some other researchers also provide evidence suggest that such initiatives related to smaller stores can improve healthy food offerings. Okay, so since we have a combination of both larger stores, aka healthy food environment or healthy food in stores, and the smaller stores that may not be as healthy, the CDC created what we call a modified retail food environment index. And basically it's an index to indicate the ratio of healthy food retailers in terms of the overall food retailers in an area. So the calculation is 100 times the number of healthy food retailers over healthy food retailers plus less healthy food retailers. So how are healthy food retailers defined? And these include supermarkets, large stores, supercenters, and produce stores within census tract or half a mile from the tract boundary. And if you're familiar with such as info group data or business listings, NAICS codes are used to identify stores. So I've listed the NAICS code for supermarket, large stores, fruits, vegetable market, just in case someone is interested in calculating the modified food retail environment. And on the other side of the equation, we have less healthy retailers. And these include fast food restaurants, small grocery stores, and convenience stores within the same distance and tract boundary. Okay. So on average, the modified retail index for the US is 10. If we look at Arkansas in particular, we have a modified retail index of 9, which is slightly below the national average. If you look at specific counties, we have counties that have very high modified retail index. And again, the higher the index indicate the higher percentage of healthy stores. So for example, where we live in Northwest Arkansas have places with very high retail index, and where near Little Rock is, they have places with more healthy stores. Okay, So there's national evidence on the association between food access and better health and nutritional outcome. For example, households with greater access to supermarkets tend to have healthier diets and lower obesity rates than those with less access. And similarly, households with less exposure to a fast food restaurant tended to have better diets and lower obesity rates than their counterparts. Another study by a group of economists concluded that of the differences in nutritional quality of purchases between low and high income households, about 1/3 can be explained by what county a person lives in, and another third can be explained by what census tract one lives in. So in other words, where you reside and your geographic location with respect to the food environment can explain a significant part of your nutritional quality and specifically food purchases. Another study that looked at the expansion of Walmart Supercenter from Bentonville, and they look at the expansion over years, and they found the Walmart Supercenter expansion to be associated with increased average BMI. And this effect was strongest for women, low-income married individuals, and those living in the least populated counties. Okay, so now we've kind of understand the issue of food access. How do we use existing policies and nutrition programs to address access issue for a better food environment? So I'm sure you guys are all familiar with the Supplemental Nutrition Assistance Program, or SNAP. It's an entitlement program. Other people who are eligible get access to the program. And income eligibility is determined based on household size and the state you reside in. The maximum SNAP benefit is actually calculated based on the cost of a what we call a thrifty food plan, which is a model spending plan for people who are on a budget. But the maximum cost is also based on a food budget that is coherent with the American Dietary Guideline. So researchers have shown SNAP reduce the severity of food insecurity and promotes health for families and for children. Under SNAP, there are different incentive programs that specifically address the food access issue. One of the examples is a Double Up Food Box program. And in particular, the DUFB provides SNAP participants with matching dollars when they spend their money on locally grown fruits and vegetables. And this program is run in both supermarkets and in farmers market. So we will talk about the definition of food desert. So if you live in a food desert, by definition, you would not have access to a supermarket. However, DUFB runs in farmers market, which kind of address the low access issue for people residing in a food desert. Arkansas started DUFB back in 2016, and thanks to USDA funding and the Walmart Foundation, the first pilot run in 18 farmers market. And the pilots were implemented by the Arkansas Coalition for Obesity Prevention, or ARCO. So this is a map me and my research team made based on the earlier evidence or earlier information about farmers market and Arkansas. So in this map, we also show urban food deserts as well as rural food deserts. So as you can see, we have pockets of urban deserts throughout the entire states. And the little black triangle is the farmers market that we're running in 2016, 2017. If you look at the farmers market with respect to food deserts, you can see a lot of the farmers market are in the vicinity or location where there are food deserts, and that's some earlier evidence that using the farmers market could help address the food access issue in Arkansas. If you're interested, we made this interactive map from the same. Okay, yeah, it's letting me. So this is a map we made based on Arkansas information. Let me see if I can share this. There you go. So on this map, you can look at specifically the population DUFB farmers market would serve. For example, you can look at markets within a specific population food deserts residents, or you can look at markets within reach of SNAP, the number of SNAP participants as an indicator for low income neighborhood. Okay. Let me go back to where I was. All right, so other than SNAP, the other nutrition programs, the special supplemental nutrition program for women, infant, and children, or WIC, also provide federal funds for supplemental foods, as well as healthcare referral, nutrition education. And this is not an entitlement program. It's state by state, and the eligibility differs. The eligibility is based on income. It's more generous than SNAP, and it focuses on specific population, in particularly pregnant, postpartum women, infant, and children under 5. So through one of the study we conducted, we found households participating in WIC have higher quality of food purchase compared to eligible non-participating households. And this difference is driven entirely by households who redeemed WIC foods during the interview week. And WIC food is particularly important to improving the healthiness of total fruit, whole grains, dairy, and empty calories. In this particular one study, geographic barriers do not seem to be limiting WIC participation. However, there are other studies who have different conclusions. So the idea is WIC is really effective in promoting food access by directly providing food vouchers for healthy food. However, what we observe is there's a decline in WIC participation, especially in children when they age. And also not all eligible people would participate in WIC. So in some way, by addressing this low or participation issue, you can help address food access. All right, so the issue of food access became even more severe during the COVID pandemic. You probably have heard or done research on this. So some of the measurement taken by SNAP or WIC include the online purchasing pilots. So during the pandemic, there's people who live in low-income neighborhood who depend on public transportation, especially at a disadvantage because of the shutdown measures. So as a result, almost all states now have implemented the online pilots where participants could redeem their benefits online instead of having to be in person at the store to redeem their benefits. And this expansion has expanded to not just SNAP, and they're also planning to redeem WIC benefits through the same pilots. So those are some measurements that would improve food environment as a result of the pandemic. Some additional thoughts on food environment. We've already talked about the role of smaller retailers. The corner stores are not have not gained much attention in the United States, but they're especially important in Europe and a lot of developing countries. There are studies that indicate corner stores could play a very important role in improving public health. Another thing that we're working on and is the relationship between food access and structural racism. So when we talk about structural racism, it's not just the distribution of race and ethnicities. It's rooted in income, social status, housing, and a lot of equity issues. So structural racism could have played a role in food access. So for example, in some areas, the access is lower. For some areas that has a majority of minority residents, access is lower compared to their Caucasian counterparts. So it's important to look at the food access issue from the structural racism perspective. The urban and rural disparity is also a big one. Over the past 20 years, the United States has gone through urban sprawl, where residents, or in more particular, wealthy residents move into the suburb. And as a result, the demand for healthy food and a better food environment increased. And that has in some way improved the food environment. But on the other hand, they could have driven up the food prices. So look at the urban and rural disparity in food environment is an important way to understand. We'll talk about nutrition program participation and the EBT. So I talk about low participation, and one of the issues is the stigma. So if someone is on a nutrition assistance program, that person might feel shame. We actually have a study that indicate being food insecure causes 3 times higher risk of mental illness, such as depression and anxiety, than losing a job. So the mental issue that is associated with food insecurity is real. And EBT is one of the measures to reduce stigma because you will no longer need to show a coupon or a food voucher. You would show a debit card, and nobody would be able to identify you as someone who's receiving nutrition assistance. However, there are issues that come with EBT because it comes with a fixed cost. The stores would have to install the EBT machines. So that disproportionately placed a higher cost on smaller stores, especially in the rural area. And there's a recent study coming out of AER showing rural smaller stores have dropped out of WIC because of this EBT transition. All right, so other than that, you all would know more about this than me. The community assistance programs can address food access, in food deserts. These include food banks, food pantries, churches, and also the local social network and food sharing system also serve as an alternative mechanism to help people in need, especially people living alone, senior citizens. So that's all I want to say about this topic, and I would happy to take any questions or suggestions or discussions.
Thanks, Dee. We have a few minutes if anyone has a burning question, but want to thank Dee for really, bringing up this issue about food access and food insecurity. I know every time I see that shiny app, it makes me think of Northwest Arkansas and obviously the impact that Walmart and some of the bigger stores have had or maybe not had on the communities that need it most. So does anyone have any questions or maybe comments thinking about access to healthy foods? I thought it was interesting seeing that map with the farmers markets overlaid on kind of the food deserts. So is it kind of based on the data that the farmers markets are in the right places? I mean, I just think of, the biggest farmers markets in Northwest Arkansas are in the major metropolitan areas where they have lots of other options. But do you think they are helping the people who need them the most?
Sure. So the thing that's unique about the UFB is not just in supermarket, it's in farmers market. But granted, farmers market only run a few months in the summer. It's not all year long, but it could reach the population that don't have access to a vehicle and who live in a food desert. So we actually have a lot more than what I'm showing on that slide. We have a lot more farmers market, and I'm sure it's growing. What I was showing is those farmers market that accept the UFB. So by looking at the overlap between the farmers market location and food desert, you can kind of see if we implement the UFB in those areas, it would help address some of the rural urban deserts.
Yeah, good point about them accepting that. Because I think, I live in Winslow, which is a little bit ways out of Fayetteville, and we have a farmer's market, but it's sometimes not a full farmer's market. But for example, I just saw, we talk about like dollar stores, Dollar General, they have a fresh produce version, a Dollar General Market. They just opened it in West Fork. So they actually now have some fresh fruits and vegetables, which I thought was really interesting.
Well, that's great. That's one of the smaller stores that could carry more weight.
They're everywhere.
Yeah.
Yeah. A couple comments about, losing grocery stores and some farmers markets where they are kind of expensive and targeting different clientele, I guess.
Yeah, but the thing about
frozen veggies, yeah, that's a good comment, Jamie, and something Jamie Baum we've been talking about is, we've gotten a lot of feedback from this group on how to eat healthy with some of the cost options on what you do have access to if you don't have access to a farmer's market or et cetera.
Yeah, farmer's market kind of cater to two types of people: the very high end, like a very price inelastic. They are willing to pay a higher price for locally grown, organic produce. So in terms of price incentive, it's limited exactly because of what Teddy was saying in the comment, because the price is higher at a farmer's market than at a grocery store. So it's something to think about, yes.
Yeah, so everyone, when you're maybe out at the farmer's market this weekend, it gives you something to think about. But again, thank you so much, Dee, for your time on this beautiful sunny Friday. Hopefully wherever you are, you can get out and enjoy some of that sunshine. And remember the challenge for this week. And yeah, Katie, enjoy that farmer's market. We will see you next week. We'll be back for Defend. And don't forget the personalized coaching sessions next week. Have a great weekend, everyone.
Thank you. Bye-bye.